Cheers.
Cheers.
And welcome to Wine Wednesday with Kriz Physical Therapy. I'm Dr. Tiffany Kriz.
I'm Dr. Mike Kriz.
And on this episode of Wine Wednesday, Dr. Mike is going to give us a little bit more information for those of you who may have had an elbow or wrist surgery but would love to continue to play your racket sport, and that could be tennis or pickleball, which does require quite a bit of torque through your whole upper extremity. So take it away, Dr. Mike.
Okay. You know, it could be as simple as the force that's transmitted through the racket to your wrist when you strike the ball. Just tapping the ball on the racket. If you don't have adequate stability in the wrist, which may not be coming from the wrist or the elbow, it might be a lack of strength or flexibility in the upper quadrant. The upper quadrant is your neck, your thoracic spine, your rib cage, shoulder blade meeting the rib cage, your shoulder, your elbow, and your wrist. So there are a lot of joints involved. And we want to make sure that we look at all of those areas for adequate mobility, adequate flexibility, adequate strength and endurance, so that during a game of tennis or several sets of tennis, that you have the flexibility where you need to, so you're not placing excess stress on your wrist or your elbow, and make you as efficient as possible. With that efficiency, by the way, comes better striking, but more importantly comes the lack of or the prevention of injury potential. And that's our goal, is to prevent irritation and or injury of your surgical site.
All right. Thanks, Dr. Mike. Cheers.
Cheers.
And thanks for watching this episode of Wine Wednesday. See you again next time.